Hi everyone, welcome to our presentation on dementia and its relation to the movie The Notebook. Our group members include David, Carly, Sophia, Rachel, Kendall, myself, Emma, Chloe, Allie, Luke, and Jana. Once again, my name's Emma, and I'm going to start things off by discussing what dementia is and its etiology. So dementia is actually an umbrella term used to describe conditions that manifest as a loss of memory and other thinking abilities severe enough to interfere with daily life. Types of dementia include Alzheimer's, which is what is actually depicted in the movie The Notebook, and vascular, Lewy body, frontotemporal, secondary dementia, and mixed dementia. There are various causes for the development of dementia, and all of them do have to do with some abnormal changes to the brain. It can result from the normal process of aging going off route, which I will discuss in the next slide, and can also result as a result of another condition, which is what we would call secondary dementia. Examples of that include Huntington's disease and Parkinson's, or from reversible causes, things which could include vitamin deficiencies, metabolic or endocrine conditions, and medication side effects. And we'll go ahead and play our movie clip.
I remember now. It was us. It was us.
Oh,
It was
darling.
us.
Oh, my sweetheart.
Oh,
I love you so much. Oh,
Noah. I love you, Angel. What happened to me?
nothing. You just went away for a little while.
How much time do we have?
I'm not sure. Last time it was no more than 5 minutes.
Okay.
Hey, I brought along an old friend.
I'll be seeing you in all the old familiar places that this heart of mine embraces all day through. In that small cafe.
How are the children?
Oh, they're fine. They were here today. Little Noah, Ava, too. They're getting so big.
Oh, boy. How fast the time goes.
Mm-hmm.
Just flies right on by.
No, yes, it does.
In every lovely summer's day.
Will you tell them I love them?
That's life.
Of course.
And I'm sorry.
Think of you that way.
I'll tell them, sweetheart.
In the morning sun, and when the night is new,
I'll be looking at the moon. But I'll
Remember
be
that story you were reading to me?
Yes.
Do you think that I could be here tonight? Would that be all right? You know what we could do? Maybe we could get a car. We could go for a ride. We could get out of here and just go someplace. You want to?
I don't think so. Not tonight, darling.
Come on, why not? Wait a minute. Why did you call me, darling? I don't know you. What's going on here? Am I supposed to know you?
Allie.
No. No! No!
Allie, sweetheart. Hey, Allie, I love you. Stay with me. Don't.
No! Who are you?
I'm Noah. I'm Noah, and you're Allie.
What do you want? What are you doing here?
Come on, baby.
Don't come near me! Don't you come near me!
Allie.
Get help! Help! Help me!
Calm down, Allie. Calm down.
No!
Calm down,
now moving into the neurophysiology, pathophysiology, and therapeutic measures. So patients with dementia, like everybody else, have nerve cells or neurons that are healthy and functioning and working properly. Now, when they develop some sort of dementia, though, these stop working due to a buildup of proteins that are being misfolded within that nerve cell or the neuron. And this will result in the loss of connection to other neurons, which eventually causes them to die. And while all aging adults may lose neurons, those with dementia lose them at a much greater number, which results in the manifestations that we see in Allie in the movie The Notebook and in other patients in the real life and clinical settings. So pathophysiology is very similar to neurophysiology, as this condition primarily affects the brain. As the condition continues to manifest in the body and goes beyond the neurocognitive function in the later stages, we will see pathologic reflexes such as grasp, root, and suck reflexes. Patients may become mute, develop incontinence, or muscle weakness, which could lead to immobility and potentially being bedridden, and poor swallowing. So each of those have their own pathophysiology, but that stems from the neuropathways that end up collapsing due to those neurons dying off, as discussed in the neurophysiology. For therapeutic measures, we know that dementia is a non-reversible condition, so we can really only treat the symptoms. That includes both the cognitive and the non-cognitive. To treat cognitive symptoms, doctors can prescribe and nurses can administer the cholinesterase inhibitors, and these will treat symptoms that are associated with memory, thinking, language, judgment, and other thought processes. And they can also prescribe the glutamate regulators, which work to improve memory, attention, reasoning, language, and the client's ability to perform simple tasks. Non-cognitive symptoms can be treated by orexin receptor antagonists for insomnia, and then atypical antipsychotics can be used as sort of add-on therapy or off-label usage purposes.
Hello, I'm Jana, and this is my first NCLEX question. So it says, the nurse displays an understanding of dementia when they correlate it to which of the following causes. Select all that apply. We have A, accumulation of misfolded proteins in the neurons, B, irregular sleep patterns, C, a secondary result of other conditions like Huntington's disease, and D, metabolic or endocrine conditions. And the correct answers are A, C, and D. So dementia occurs as a result of abnormalities in the aging process. Irregular or disturbed sleep patterns are not directly linked to dementia.
Okay, and then here we have the diagnostic procedures according to DSM-5 criteria, and we're going to be looking at the middle column where it says major neurocognitive disorder / dementia. So in order to be diagnosed with this condition, a patient has to have significant cognitive decline in one or more cognitive domains based on the two criteria below. And then they also will have interference with independence and everyday activities as a result of those declines. And then both neurocognitive or major neurocognitive disorder or dementia and mild neurocognitive disorder that's displayed here has to meet the criteria in C, D, and E to be diagnosed.
I'm Carly, and I'll be covering the delivery of nursing care for patients with dementia. First off, we have legal healthcare policies. Institutional and healthcare policies are to ensure legal, standardized, safe care that is aligned with current best practices. So for example, medication administration, restraints, and care plan documentation. Bodies like Centers for Medicare and Medicaid Services make guidelines on the matters like staffing ratios, safety protocols, and really importantly, medications like antipsychotics, which are often prescribed to manage behavioral symptoms in patients with dementia. So an example of legal health care policies affecting the delivery of nursing care might be Nursing homes need to follow the strict regulations regarding staffing levels to ensure safety, including having enough staff members trained to handle any kind of behavioral disturbances. And then we also have clients' rights. Individuals with dementia experience cognitive decline that impairs their ability to make fully informed decisions about their care. However, they still have rights that must be respected just as any other individual without a mental impairment, such as the right to informed consent, autonomy, and dignity. Care will eventually need to be passed to family members or legal guardians due to the severity of the decline from the dementia patient. After that, we have different ethical and legal standards and how they affect delivery of care. So autonomy, beneficence, non-maleficence, and justice are some of the very important standards surrounding care for a patient with dementia. As dementia progresses, patients lose the ability to understand or communicate their preferences and wishes. So nurses need to advocate for fair treatment and equal access to care, just because this patient population is so vulnerable due to their condition. And caring for a patient with dementia is challenging, spreading health care providers thin and causing many ethical standards not to be held. And then we have regulations. FDA approval and use of dementia medications has strict guidelines on medications that should be used, including dosages, monitoring for side effects, and the need for informed consent from the patient or from their legal representative if the patient is not able to. So an example of one of these regulations is the FDA has issued a black box warning about the use of antipsychotic medications in older adults with dementia due to the risk of death or stroke. And then there's economic issues. High costs of long-term care and the increasing prevalence of dementia leads to shortages of options for these patients. The later stages of the disease require more intensive care, which often means there are more expenses. Like, for example, families have a hard time balancing trying to work to afford their own life while paying for a nursing home, or being a part-time / full-time caregiver and not being able to work due to the commitment that they're making to care for their family. And then we have cultural diversity and ways that can affect the delivery of nursing care. Cultural beliefs about aging, mental health, and family roles can impact care. Nurses need to be sensitive to client preferences and support families by respecting their cultural values. An example of a different cultural belief might include the preference of care to be provided from the family rather than from healthcare providers. Or some cultures carry stigma regarding mental health, so families may feel they don't want to discuss the diagnosis or the signs and symptoms openly, which might lead to delayed treatment or diagnoses.
It's Jaina again, and this is our second NCLEX question. So which of the following statements made by the newly licensed nurse demonstrates the need for further teaching? We have A, differences in cultures allow families to take care of clients with dementia at the home. B, in some cases, clients with dementia at healthcare facilities are prescribed antipsychotics to help manage behavioral symptoms. C, because a client with dementia cannot give informed consent, they will be forced to take their medications. And D, as dementia progresses, it can become more costly to receive healthcare services. And the correct answer is C. So though clients with dementia cannot always give informed consent, they have the same rights as every other patient, such as autonomy and dignity.
Hi, my name is Sophia Blaine, and I'll be talking about the etiological factors and stressors throughout the life cycle. So some etiological factors include age. Alzheimer's typically affects those over the age of 65, as we can see with Ali in the film The Notebook. Another factor is genetics. So family history can increase the risk of developing Alzheimer's. Although the movie doesn't directly mention a family history, genetic factors remain a crucial element in the onset of the disease. Some health-related factors, such as cardiovascular disease or diabetes, can increase the risk of developing Alzheimer's. And again, this wasn't specifically addressed in the film. And then lastly, some changes in the brain. So Alzheimer's disease is caused by changes in the brain, such as a widespread loss of brain function, as many neurons stop properly working and eventually die, leading to the disruption of communication between brain cells. Some stressors in the movie were memory loss. The primary stressor shown in the film is Allie's significant memory loss, which affected her ability to recognize her own family and even her husband, Noah. Some stressors were also caregiver burden. Noah endures a lot of emotional and physical burden as he provided constant care for Allie. Also, loss of independence. As Allie's memory fades, she loses her ability to care for herself, which increased her dependence on Noah and the nurses. Family stress was also a big stressor. The emotional toll on Allie's family, especially her children and her husband, is significant in the film. They experience grief and frustration as they cope with cognitive decline. Lastly, cognitive decline is its own stressor. The slow decline of Allie's ability to think clearly and manage skills becomes an emotional challenge for both her and her family. Now moving on to psychological, social, cultural, and spiritual safety factors. Starting off with psychological factors, the first one is to maintain emotional regulation. In Allie's case, her emotional outbursts can be minimized with routine and emotional reassurance. Another one is replacing dysfunctional behaviors. So Alzheimer's often leads to agitation or wandering. By creating a calm environment and a simple yet predictable routine, it can help minimize sudden changes in Allie's mood. Moving on to social, maintaining relationships. For Allie, maintaining a strong relationship helps her preserve a sense of self, especially with Noah. Strong emotional bonds are important to prevent social isolation. For spiritual safety factors, faith in relationships. Noah's faith in Allie recognizing him shows the deeper spiritual bond they have, which helps both of them navigate through the struggles of Alzheimer's with a sense of meaning and purpose. Lastly, cultural sensitivity. The portrayal of Alzheimer's disease in the film The Notebook emphasizes the role that family plays in caregiving, which is an important cultural value in many societies. Cultural expectations on caregiving can impact how families navigate through life with managing the disease.
My name is Chloe, and I'll be discussing the strengths and deficits of this case. For strengths, we see strong emotional bonds, and this is shown through Allie's consistent recognition of Noah, even with memory loss, shows their deep emotional connection between them. This bond helps maintain a sense of identity for Allie and also gives Noah a sense of purpose. We also see family support. Even though Allie's family experiences a lot of emotional distress, they consistently show support by visiting her. They remain present in Allie's life, even when dealing with grief, showing strong resilience. We also see memory recall, where Allie's ability to occasionally remember memories and familiar people. For deficits, memory loss and cognitive deficit is implicated through Allie's progressive memory loss and her inability to recognize familiar people, even Noah, which is a primary deficit that impacts her sense of self and ability to function independently. We also see dependency on caregivers. As Allie's disease progresses, her physical and emotional dependency on Noah and the caregivers increases. Lastly, loss of personal autonomy is implicated when Allie struggles with a loss of personal autonomy, especially managing daily tasks independently. I'll also be discussing Erikson's psychosocial stages of development. The first stage of development is identity versus confusion, and this occurs in the adolescence developmental stage. The virtue developed here is fidelity. This is a major stage of development where the individual learns skills that they will do as an adult. They will find out what their identity is and what this means to them. This also allows the individual to find different roles, activities, and behaviors that cater to their liking. If this stage is unsuccessful, this can lead to a weak sense of self, confusion of their place in society, and lack of direction in adulthood. After spending summer break with Noah, Allie is 17 years old, and she comes home to find that she has been accepted to a highly reputable art school. Her parents strongly support her decision of going to this school, but she begins to feel conflicted. The thought of being with Noah flooded her mind, but also knowing that being with him would go against her family's goals for her. Her individual desires of being with Noah and the ideals and roles that her family want for her to be in create significant conflict for her identity. The second stage of development is intimacy versus isolation, and this occurs in the early adulthood developmental stage. The virtue developed is love. During this stage, individuals start to open up more intimately with their peers, which leads to strong bonds and comfortability along with mutual dependency. If this stage is unsuccessful, the individual can feel a disconnection and isolation from their peers, leading to living in fear of rejection, but also lead to loneliness and depression. The second act of the film shows the reconnection of Noah and Allie's intimacy, and this occurs when Allie is 24 years old. Their love is reignited when Allie sees that Noah's house was restored in the newspaper and she goes to visit him. The reunion shows that intimacy can be rekindled after a long separation with the help of trust, honesty, and vulnerability. During their time apart, Noah and Allie were isolated, but the reunion reminds us that intimacy has the power to overcome time, distance, and pain. Lastly, integrity versus despair occurs in the late adulthood developmental stage, and the virtue developed here is wisdom. This stage usually occurs later in life at the ages of 65 and above. The individual begins reflecting on their life and can either feel satisfied or regretful. As we grow older, we slow down our productivity and begin exploring life as retired individuals. At the age of 70, Allie begins to struggle after she was diagnosed with Alzheimer's. As she slowly loses her memories, she forgets about her past with Noah and who she is almost entirely. Her losing memories leads to the loss of identity and memory that leads to a sense of disorientation and emotional loss. Noah's dedication to her allows her to feel some sense of clarity in the midst of her confusion. However, her struggle seems to become worse as her diagnosis creates profound tension between integrity and despair. When she is unable to recall her history with Noah, she gets confused and sad, which contributes to the feeling of having an incomplete life.
Hi, my name is Kendall, and I'm going to be doing the nursing process for the notebook. So Allie Hamilton is the character that we are doing it on. She has senile dementia, which is a progressive form of Alzheimer's disease, and she is currently in a skilled nursing facility. So during the assessment, physically she is unable to independently perform all her activities of daily living. She has anhedonia, which means she's lost interest in some things that she used to enjoy, and then she has decreased hunger. Psychologically, she has memory loss, changes in mood and behavior, and then disorientation to place and time. For some nursing diagnosis, I have chronic confusion related to neurological dysfunction as evidenced by irreversible onset of memory loss, anxiety related to a sudden decline in mental awareness as evidenced by tense body language and voice quivering. And then lastly, we have social isolation related to the inability to engage as evidenced by the desire to be alone. So for planning, we have a couple interventions that we would want to do. Promoting person-centered care through supporting, engaging, educating, and supervising staff and other caregivers, assessing the client's level of anxiety and physical reactions to anxiety, and then assisting the client in identifying activities that encourage socialization. So the way these were implemented in the movie is the nurse at some one point in the movie reoriented the patient to now and provided reminders of past enjoyment, and then provided medications to calm the patient down in times of stress and confusion, and then established trust with the patient, encourage family to visit, and encourage the patient to participate in the milieu. So evaluation: was the patient's confusion resolved when we reoriented the patient? So some days Allie would remember for a brief period of time and became oriented after hearing the story of her and Noah that he would read to her every day. and then relief after the medication was given. So at one point she had a panic attack when she became oriented, and then she reverted back and didn't remember who Noah was anymore. So she'd had a panic attack and medication was given, and Allie visually relaxed after that. And then is the patient participating in her surroundings? She was able to remember how to play the piano when the nurse gave her a little encouragement that she used to play, and she was able to participate in that out in the room that everybody was in. So she started playing the piano there, and then her children came to visit, and by kind of to not stress her out, they told her it was just his children and not her children, so she interacted with them a little bit as well.
Hi, my name is Allie, and me and David will be doing the nursing care plan. I'll be talking about the short-term goal for Allie, and then he's going to go over the long-term. So to start us off, our nursing diagnosis is chronic confusion related to irreversible neurological dysfunction secondary to her Alzheimer's disease, as evidenced by her inability to recognize familiar people, including her husband Noah, disorientation to time and place, and frequent episodes of repetitive questioning about recent events or personal history. So her short-term goal will be in about a 1-month period. So Allie will demonstrate improvement in orientation to time, place, and situation during interactions, exhibiting brief periods of memory recall and recognizing familiar people, such as her husband Noah, for at least 10 minutes in a 1-month period. So with our interventions, our first one is we want to reorient Allie to a time, place, and situation during each interaction. This is crucial. So every time we engage with Allie, we want to remind her of the current time, the date, where she is. So for example, Noah could say when he goes to visit her, "Hi Allie, today is Thursday afternoon, and we're sitting here in your living room and we're going to read a story." So when you're providing her visual clues, like a calendar or a clock to help her with the time and date, that may be able to help her be more aware of her surroundings and make her more familiar and help calm and ground her. We also want to, number 2, engage Allie in reminiscent therapy using photos, music, and past events. So we want to maybe use a photo album or play songs that Allie has enjoyed throughout like her life, maybe her wedding song or one of her like favorite tunes. You could even say like, "Is this you and Noah on your wedding day? Do you remember that day? Do you remember anything special that happened?" So it's something like that would be great. We also, for intervention number 2, we want to monitor her for signs of delirium and treat any underlying causes such as infections, dehydration, and medication side effects. So we want to make sure we're regularly assessing Allie's like physical connection, because with her disease, it's also important that we watch her infection, fever, changes in her vital signs, dehydration, so like dry mouth, low urine output, and any adverse effects from her medications for Alzheimer's. And then, so the rationale between these is, number 1, we want to reorient her. So this is just going to help reduce her confusion and anxiety. And then we also want to use the reminiscent therapy because it has been proven to stimulate long-term memory and provide emotional support for patients with dementia. It's also super therapeutic. It may also help her to prompt her short-term memory recall and just improve her overall engagement when her family comes, reduce her agitation she feels. And then monitoring for delirium is so important. It's crucial because cognitive symptoms in dementia can worsen due to infections, dehydration, or side effects of medication. So we always want to address these underlying issues and make sure she's not going to decline mentally and causing any further emotional distress. And we're hoping these goals are met. As you can see in the movie, she does end up remembering Noah as her husband, and they end up passing away together, and it's a beautiful, beautiful story. And it's so nice that every time he comes, he really does use these interventions, and it's just so therapeutic for her, and you can see how much she's struggling and how she does so well when she has that brief period of memory recall. So now David is going to be going over the long-term outcome for her, and yep, thank you.
Hello, my name is David Abejo. I'll be doing the long-term goals for the care plan, and I'll be doing the nursing diagnosis for chronic confusion. So, for a long-term goal, Allie will demonstrate improved orientation and memory recall by participating in familiar activities, such as playing the piano and interacting with the family over the next 3 months. For intervention, we want to promote person-centered care, which includes getting to know the unique and complete person, recognizing, accepting the person's reality, supporting their ongoing opportunities for meaningful engagement, and evaluating care practices regularly. The rationale is by understanding the individual's past and sharing memories enhances communication and clients and staff satisfaction. Next is to facilitate the use of music therapy via activities, staff, or electronic sources such as Amazon Echo, Alexa, and Google Home to identify and we also want to identify the client's musical preferences and interview family members if necessary. Music therapy is beneficial and improves behaviors, anxiety, depression, and agitation in people living with dementia. I chose this intervention because she is a musician. She knows how to play Chopin on the piano. Next intervention is to provide opportunities for contact with nature gardens or nature-based stimuli, such as facilitating time spent outdoors with a safe walking path or indoor gardening. The rationale for that is to improvements in mood among clients with dementia were associated with exposures to nature or relatively short duration. So we want to continue doing this. We saw this in the movie where her and her husband were sitting outdoors in nature, and then they were also talking with their family outdoors as well. So for the long-term goal evaluation after 3 months, Allie was able to recall and engage in activities such as playing the piano and discussing family memories, but her orientation fluctuated. The outcome is that Allie showed some improvement in participation and memory recall, but remains inconsistent due to disease progression.
This is Rachel. I'll be talking about society's view/stigma. So the notebook's portrayal of dementia is relatively accurate when it comes to symptoms, maybe just a little dramatized at times. For example, Allie's moment of clarity near the end of the movie is like an on and off switch. While Alzheimer's patients may have changes in mood and behavior, it's not nearly as abrupt or dramatized as the movie portrays in this scene. Also in the movie, the attending physician does use the outdated term senile dementia. This term can perpetuate the stigma that dementia is a result of aging rather than the disease, and it was dropped as a term. By the 1980s, it was replaced by the term Alzheimer's. Overall, the movie provides a pretty good view of the disease in regards to symptoms and especially caregiver strain, as you can really see the effect Allie's dementia has on Noah. This brings awareness to this aspect of dementia and the importance of resources for caregivers.
I'm Luke, and I'm going to be presenting on what the movie portrays with dementia, and then versus what we really see in the real world. First off, the movie describes Allie's condition as progressive and irreversible. This is true in the clinical setting. Alzheimer's is a progressive illness that cannot be reversed. Throughout the movie, Allie has issues with short and long-term memory. This is also true in reality. Short-term memory loss usually comes first in the beginning stages of the disease, and then long-term memory happens generally very late term, where they can't really recognize faces and things like that. There's also a scene in the movie where a nurse reminds Allie that she can play the piano, and she begins to play a song from memory from her past. This can be actually true in reality as well. You've seen instances of people with Alzheimer's playing music from their past, from memory, and it's also beneficial. Music therapy is also very beneficial for Alzheimer's patients, playing music from their past as well. And then there is also an instance later in the movie where after her husband has been reading from the notebook for pretty much all day, she suddenly remembers her past with absolute clarity. She kind of snaps out and seems to be almost completely like healthy older adult. But in reality, while there usually can be increased periods of memory, it's unlikely that Alzheimer's patients suddenly remember everything from their past, and like they don't have the disease anymore. So this was something that the movie really kind of changed for the story's purpose. Also after this episode, she kind of snaps right into sundowning after she kind of snaps out of this moment of clarity, where she's agitated and suddenly forgets everything. While this sundowning is a real thing and patients do become slightly more agitated and confused, that episode was also kind of slightly exaggerated for the story as well.
This is Jana with our third NCLEX question. So it asks, which of the following are typically seen in those diagnosed with dementia? Select all that apply. We have A, deficits involving short and long-term memory loss. B, Alzheimer's is also known as senile dementia. C, clients with dementia may experience increased memory and remember their past in segments. D, all types of dementia are irreversible. And E, all of the above. So the correct answers are A, B, and C. So not all types of dementia are progressive and irreversible. So I'll continue on with the evaluation of the experience. So overall, I would say yes, watching the film was useful. Though the actual experience of dementia wasn't the focus, it helped to give some general insight in what it may look like to others who haven't had any experience with the condition. Showing that Allie is both very forgetful in her late stage of dementia and could still remember fragments was accurately portrayed, as memories can come and go. It also depicted how frightening the experience can be for those with dementia, as Allie completely forgot who her husband, Noah, was after they shared a moment of remembrance together. And when would I recommend this film to others? So I would say that this film would be a great recommendation to those who would like to or need to see a surface level understanding of dementia. Because it was very dramatized in the film and didn't go exactly into its specifics much, seeing how both the one with dementia and the spouse without it handled their interactions was important. It displayed that as frustrating and out of our control dementia can be, it feels the same to the person who couldn't remember a lifetime's worth of people, memories, and events. Empathy is one of, if not the most significant components of living with dementia throughout all perspectives.